I'd like to thank the organizers for including me in this session. I'll be talking about some preclinical studies of hyperthermia-mediated drug delivery. So our work in this area is motivated by the need to improve local control for pediatric sarcoma without increasing systemic toxicity. And we're focusing on doxorubicin. It's a chemotherapeutic agent that's widely used in children's cancers, but its lifetime dose that's allowable is limited by increasing risk of toxicity to the heart. So we would like to maximize the therapeutic ratio of doxorubicin that gets to the tumor versus the heart. And our approach is to use hyperthermia-mediated doxorubicin delivery from thermosensitive liposomes. These thermosensitive liposomes with doxorubicin being carried in them leak a small amount of drug in the systemic bloodstream, but with localized heating in the tumor, they release large quantities of the active drug in the tumor vasculature. This free DOX can fill the extracellular space, but it takes a while for it to accumulate in the tumor cells. So our hypothesis in this study, and based on a lot of the work from other investigators in the field, is that longer heating duration will increase the therapeutic ratio for doxorubicin when we use thermosensitive liposomes. And by that I mean by heating for a longer period of time, we can increase and maintain the high extracellular concentrations, which can then drive uptake into the tumor cells over time. Meanwhile, in the drug that we release within the tumor bloodstream should have very little effect on the systemic concentrations, and so the drug dose to the heart should not be affected when we heat for longer periods. In this study, we used a rabbit VX2 tumor model, and we used it with the Sonolive MR-HIFU system with the hyperthermia software prototype. Instead of ablating tissue, the hyperthermia system aims to maintain temperatures in the range of 40 to 43 degrees for durations of up to an hour. And you can see we can maintain an average temperature around 42 for a long duration. And it does this based on real-time feedback from MR thermometry in multiple slices. And so we're heating the whole region at once and continually heating that for durations of up to an hour. In our study, we implanted tumors into both thighs of rabbits. And so one of the tumors was targeted for hyperthermia and the other served as an unheated control. Rabbits were divided into two groups, and they received MR-HIFU hyperthermia for either 10 or 40 minutes. During heating, thermosensitive liposomal doxorubicin was administered, and 3 hours after infusion, tissue samples were harvested for doxorubicin quantification using LC-MS. For drug delivery, our goal in heating is to maintain temperatures capable of triggering drug release without causing vascular damage. And so based on our MR temperature measurements, we can see that the time that the targets were above 40 degrees matched the prescribed 40 in 10 minutes. And the time above 44 degrees, where vascular damage is likely to occur, was quite minimal. We can also look at the spatial distributions of thermal dose. And so among our treated animals, in the 40-minute group, only the hottest 10% of the tumors actually reached a temperature that might be damaging. And so if we look across the two treatment groups, other parameters were quite similar. So those include the average temperatures in the target area, the rabbit body temperature, their weight, and the tumor diameters. If we look at doxorubicin concentrations in tissues measured using LC-MS, in the non-targeted tissues of the heart and the unheated tumor in each rabbit, there's very little difference between the two treatment groups of 10 and 40 minutes. And then in the heated tumors, there's higher drug concentrations in general. And when we went from 10 minutes of hyperthermia to 40 minutes of hyperthermia, the doxorubicin concentrations roughly doubled. So this shows that the systemic toxicity does not increase when we go to longer heating durations, but the drug accumulation in the targeted tumors does. And we could state this another way. We talk about the therapeutic ratio between tumor DOX concentrations to the heart. And so in the unheated tumors, the ratio is actually less than 1. And then when we look at the 10-minute hyperthermia group, the therapeutic ratio is roughly between 1 and 3. And that increases to between 3 and 5 for the 40-minute hyperthermia group. So to conclude, in our study, we showed that longer heating times do increase doxorubicin accumulation in targeted tumors without increasing toxicity to the heart. And so we feel that this will have some clinical implications on trials such as Celsion's phase 3 Optimo study on how they do their heating. And some of our future work, we're next going to investigate whether the therapeutic ratio can be increased when we use a lower dose of thermosensitive liposomes due to a saturation of the drug uptake rate in tumor cells. And in parallel, we'll soon be enrolling patients in a pilot study of MR-HIFU hyperthermia combined with conventional liposomal doxorubicin in pediatric sarcoma patients at UT Southwestern. Thank you.